Congratulations on making the right decision for you and your patients to incorporate our SLX clear aligner system into your practice. SLX clear aligners are uniquely clear, they provide an excellent fit, and they offer numerous workflows and treatment efficiencies. Although this is a new solution available to you, over 50,000 patients have already been treated with this aligner technology in international markets. In today's video, we'll start with some introductory information on getting started and your patient's first appointment for records. We'll then walk you through each step of submitting a case. And we'll conclude this overview with tips for managing your patient's treatment and recommendations on case finishing. SLX clear aligners are a series of clear, lightweight, plastic appliances indicated for the correction of dental malocclusions in patients with permanent dentition. SLX clear aligners are intended to position teeth by way of continuous gentle forces. SLX clear aligners are BPA-free, but they may not be suitable for patients who are overly sensitive to plastics. Like most other aligners on the market today, each aligner is designed to be worn throughout the day and night, but should be removed during meals and while brushing. The recommended wear schedule is 2 weeks for each stage. The choice of a 7-day or 3-week wear time per aligner is a doctor decision that you'll need to make depending on the circumstances specific to each individual patient. Who are the best candidates for treatment? Whether you have a lot or very little experience in treating patients with aligners, we recommend that you start with treating mild to moderate conditions and address any corrections to the patient's posterior bite by using carrier motion 3D appliance prior to starting SLX clear aligner therapy. Using the motion 3D appliance to accomplish the most difficult movements at the beginning of treatment is an extremely effective and patient-friendly treatment approach. This simplifies and standardizes your aligner cases, reducing the total treatment time and the total number of aligners and attachments required. Before walking you through each step of submitting an SLX aligner case, there are 2 important terms we'll refer to often throughout the process. To submit SLX aligner cases to us and to manage all your patient's case information, you'll log in and use our web-based portal, DDX. DDX stands for Digital Dental Exchange. You can access DDX on a PC or Mac through any modern internet browser, with no software to download or maintain. This online portal allows you to access your treatment setups and manage your patient's cases 24 hours a day, 7 days a week. All your case records are stored indefinitely in DDX, and the powerful search makes it easy to locate historical cases. The second term, SLX Studio Pro, is the interface that you will use to review and approve your treatment setups. And you'll do this without ever having to leave your DDX browser. Your first step in starting an SLX aligner case will be collecting the required patient's records. These records include a standard set of photographic records and impressions of both dental arches along with bite registration information. Dental x-rays are always helpful and welcomed as well, but they're not required. If your patient's treatment started with a motion 3D appliance, please take the time to remove the appliance before taking records. For each case, you'll upload 8 required photographic views of your patient's face and teeth. This includes 3 extraoral photos, the patient's profile, and 2 additional headshots showing the full face at rest with lips together and no smile, and at the same angle with the patient smiling with a natural smile. Additionally, 5 intraoral photos are required, including the upper and lower occlusal views showing all teeth in the arch, and with the posterior teeth occluding, retracted views of the anterior and the left and right lateral views. All pictures should be recent and clearly represent the details of your patient's dentition. For all case submissions, we require high-quality, full-arch impressions of both dental arches. We accept digital impressions files in STL format from all modern intraoral scanners. While the preferred impression type for all submissions is digital, VPS or PVS impressions are accepted in some countries. Please speak to your sales representative for further details if you're not able to submit digital impressions. As a reminder, if your patient's treatment started with a modern 3D appliance, please take the time to remove the appliance before taking this initial impression. This helps assure that the scan reflects the most complete and accurate depiction of your patient's dentition. Less precise and inaccurate representations of your patient's dental anatomy can compromise the aligner's fit on the teeth, which can then negatively impact the overall efficacy of the treatment you have planned for your patient. Also, remember to remove the motion 3D appliance when the preferred position with the canines in 1/4 cusp of overcorrection is achieved. It's important to overcorrect to a superclass 1 position before going into aligners. After you remove the motion 3D appliance, create a vacuum-formed retainer, such as an Essex Ace retainer, to hold the maxillary arch in place during the manufacturing time of the clear liners. Cut 2 elastic slits on the upper retainers. Send your patient home with the 2 upper and lower retainers, along with light class 2 elastics, such as 2-ounce class 2 elastics for nighttime wear to maintain tooth position in between the Motion 3D appliance treatment and the SLX aligner treatment. If there are buttons that you would like to continue using and you want us to provide cutouts, we can do this. Please indicate this in the instructions. For practices located in countries where VPS or PVS impressions are accepted, it's important to provide us with high-quality upper and lower impressions using a disposable tray as well as a bite registration. Any type of full arch tray can be used as long as it accommodates all of the patient's dentition. If any part of the dentition is missing, your impressions will not be usable and will need to be remade. We do not accept stone models, and because we do not return your impressions or trays, please use disposable trays. Now that you have the required patient records ready to submit, let's walk through each step of submitting your case online through the DDX approval portal. Simply log into DDX and select a new case. This will generate a simple web form where you will enter your patient's information, your treatment goals, and upload the patient's records. In the Work Requested section of our prescription form, you should only indicate the final treatment goal. Our form does not ask for your diagnosis of the patient's current and untreated conditions. To help make this form quick and easy for you to complete, the most common correction requests are set as the default settings. To make changes to these default settings, simply select another option from the drop-down menu. Another time saver within our DDX approval portal that's also designed to minimize communication errors is the tooth icon you see on the form. Clicking the icon generates a tooth chart for you to use to indicate an action that should happen to a specific tooth or groups of teeth. For example, you can use this chart to indicate teeth that you prefer to be included for interproximal reduction as needed. Simply click the instruction on the bottom of the chart, followed by the relevant teeth for that action. Once you've completed the Work Requested section, it's time to upload your patient's records. The Specified Files area allows you to drag easily and drop your patient records as a group or selectively upload files individually. For step-by-step instructions on how to upload your patient's records, please refer to our SLX Clear Liner Quick Start Guide. If you're located in a country where physical impressions may be shipped to us, use the Impression Type drop-down box and select PVS Impression. In the Notes section, please enter any specific treatment instructions or preferences here. Our technicians rely on your directions, so please take time to describe your treatment goals and how you want movements to occur. Next, you may save the information to review and complete later, or you may click on the Submit Case button when you're finished and ready to submit the case. Before closing your DDX session and your browser's window, please wait for the prompt with the final screen that confirms your submission is complete. If you selected PVS impressions for the impression type, you'll see a prompt to print a shipping label in DDX after the case submission is completed. When preparing your package with the patient's impressions and bite registration, do not forget to print a copy of the patient's treatment form to include in the box being shipped with the records, so we know who the treating doctor is and which patient's records are included. Once we receive all the required patient information and records, our Design Studio Lab technicians will begin the work to set up your case. It's crucial to note that for practices shipping impressions and bite registrations, the setup process does not start until we receive all of the required records. We will provide the initial treatment setup to you within 5 business days of submitting full patient records. When your proposed treatment setup is ready, you will receive an email notification. You may also check DDX 24/7 to see which patients' cases are ready to review in the Open Cases section of DDX. Here are some tips in reviewing your patient's initial treatment setup and requesting any modifications if necessary. Inside the Open Cases section, click on the case number associated with the patient's treatment setup you'd like to review. First, check the Notes section to see if the technician provided comments. Next, double-click on the icon image in the Work Requested section to open the file in SLX Studio Pro. SLX Studio Pro provides 3D models for viewing as well as modification tools for efficiently communicating with your Design Studio Lab technicians. When reviewing your patient's treatment setup online, it's essential to examine the final occlusion proposed, making sure it reflects your desired tooth positioning as well as your treatment goal for the patient's occlusion. Our treatment setup differs from other aligner manufacturers' software setups. Our proposed setup represents the final goal for the patient's tooth positions. This means you do not want to request overcorrection on the proposed plan because we will use your accepted treatment setup as the final treatment goal if any refinements are needed. If a new treatment setup after approval is requested because you want to change the planned final occlusion, a new setup fee will be charged. To view alternate angles of the model, select from one of the options along the left side of the screen. They are front, right, left, back, bottom, and top. In addition to reviewing the final occlusion and tooth positions in the setup, click on the 3D IPR button to review the proposed IPR, interproximal reduction, or the IPR button for IPR and cutouts, slits, or EBT, elastic button technique information. What is EBT? EBT, also called bootstrap or slingshot, is a popular way to efficiently and predictably extrude a tooth. EBT allows you to target a specific time frame to extrude and avoid long-term attachment use. To extrude, a clear button is bonded to the facial surface near the gingiva of the tooth you want to extrude. An elastic is worn from the button to either a button on the lingual of the same tooth, to a lingual slit cut into the aligner, or to a button bonded to the opposing arch. SLX clear aligners can accommodate EBT or attachments. It's your choice as a clinician. Again, the initial treatment setup may include suggested IPR or EBT, but this is not a prescribed treatment requirement until you, as the doctor, accept the treatment plan. You may reject these recommendations during the case submission process in the Work Requested section, or once you have received the treatment setup by clicking on Modify and stating your changes in the notes. If it's necessary to make modifications, simply send notes to our lab technicians and they'll make corrections within 2 business days. For detailed instructions on how to use the modification tools, please refer to the SLX Clear Aligner Quick Start Guide. Please be aware that all your cases will remain on hold until you review and approve the proposed plan. Once you approve the treatment setup, we will ship your SLX aligners from our facility in approximately 10 to 15 business days. The full case of aligners for your patient, including the retainers, will be shipped to your office. If attachments are part of your patient's treatment, the aligner package will also include the transfer trays. Let's review the timeline and the variance that can happen in all cases. First, our 5-day time to create your patient's treatment setup doesn't start until we have complete records. If you're missing a scan or a photograph, the 5 days doesn't start until we have all the required records in a high-quality format. Next, the timeline for aligner manufacturing is heavily dependent upon the doctor and how long it takes to review the initial treatment setup and any modified versions before approving the patient's proposed setup for aligner manufacture. With this variance in mind, it's nearly impossible for an office to predict when the practice will receive the aligners at the time of the patient's records appointment. Instead, we strongly suggest that you wait until the patient's treatment setup has been approved to schedule his or her aligner delivery appointment. Treatment management. At the patient's aligner delivery appointment, you and your team will want to check the aligner fit for the first stage, show the patient how to insert and remove his or her aligners, and review the SLX aligner instructions for use brochure. The doctor will perform any IPR indicated. IPR instructions are provided in a form that's located in the aligner shipment box, and they can be downloaded from the DDX portal as well. SLX aligners are uniquely made from a single precision mold of the patient's teeth, which are then physically moved using our proprietary process that allows for better tracking and a more predictable outcome. This more predictable process, however, can't be previewed digitally since it's not created in a virtual world. Each step is recorded during manufacturing for you to see in the case's material movement record. Near the time of shipment, we will provide this material movement record. We will upload this record as a PDF to the DDX portal, and we will send a hard copy of it with the aligner package. This document will allow you to monitor patients' movements to ensure they're tracking appropriately through their treatment steps. Once we have manufactured the aligners, we will also provide you with directions on the location and timing for EBT. As indicated, you will bond buttons near the gingiva of the teeth involved for the extrusive movements. Aligners will come pre-trimmed for cross-arch elastic use unless you have indicated buccolingual placement. You may use any type of bondable buttons and elastics that you prefer. After the aligners have been modified and the buttons are bonded to the teeth, you'll want to instruct your patient on the proper elastics wear. What should you do if the patient loses an aligner? Direct patients to keep their most recently used aligners. If needed, instruct them to use the previous set for one more week for full settling and then skip the step that has been lost. Initial wear of the new step might cause some discomfort, but worn long enough, the teeth will fully settle and the patient can progress as nothing was lost. If the next step absolutely will not fit, have the patient temporarily use the previous set while replacements are being made. Replacement aligners are available for purchase and will generally ship within 10 to 15 business days after placing the order. If at any time select teeth are not tracking or lagging behind, please ask your patients to use Chewies to help firmly seat the aligners. The recommended wear schedule is 2 weeks for each stage. Longer wear time per aligner might be needed if compliance is suspect. Also, please double-check the IPR instructions. If the amount of IPR that was planned was not fully followed, that can cause tracking issues as SLX aligners fit so close to the teeth and don't have quite as much flex as other aligners. Again, each individual patient might need more or less time in each tray, and SLX aligners' performance is reliant on your treatment plan and clinical expertise. Refinements are an option if further tooth movement is needed in order to meet the original treatment setup. Please follow the directions provided in the Quick Start Guide to open your case and choose a remake procedure. HSO will then provide as many trays as needed to achieve the originally approved treatment goal. No new treatment setup will need to be reviewed and approved. HSO will provide you with a set of aligners in approximately 15 business days from submission. If a new treatment goal is needed for your patient, a revision for a new final occlusion can be submitted for a small setup fee and price per aligner. For any type of refinement or revision, new records and photos of the patient with aligners on the teeth are required for our review. Please refer to the SLX aligner terms and conditions for further information about the assurance plan. Remember, you have access to constant technical support. Henry Schein Orthodontics has a dedicated SLX clear aligner customer service team to assist your team with any aligner questions. Don't hesitate to give us a call. Thank you for learning more about the next generation aligner solution, SLX Clear Aligners by Henry Schein Orthodontics.